Sara Steady. It's used to take your patient from point A to point B. It goes up to 400 pounds. Your patient needs to have a MAT score of 3 or higher, which means they can go from sit to stand unassisted. Your patient needs to be alert, oriented, and able to follow commands. They also need to be able to bear weight on one leg and hold on with one arm. Okay? Pointing out some of the parts of the machine. These are the levers to open and close the legs. We open and close the legs to get around stuff. It's not for stability. These are the brakes, and with the Sara Steady, you use the brakes anytime you're getting a patient up or out of the machine. These are the swivel seats. We use this to get a patient in, and your patient sits on these. And this is the leg knee brace where your patient's knees engage. Okay? So now I'm going to go into my patient. And what I'm going to do with my patient is I'm going to get these swivel seats out of the way. Make sure you're walking around to get close to them so you're not overreaching. With the legs open, I'm going to move into my patient, and I'm going to ask my patient to put their feet on the foot plate. I move it in so that their knee is touching the knee brace, or close, and then I lock my brakes. I come around and I ask my patient to put their hands on the bar, and go ahead on 3, come to stand. 1, 2, 3. Okay. Now I took the swivel seats down and asked my patient to sit. When they've sat, they slide forward so that their knees are touching this knee brace. Now I unlock my brakes. Use my knees and my core to pull the Sara Steady back. Then I close the legs. If I need to go that direction, I walk around and grab the grooves of the seat and push the patient in the direction that I want to go to. Then I walk back here and push my patient, okay? To get them back in the chair. Again, walk around, push the Sara Steady in the direction that you want it to go in. Open up the legs. Push it back until you're almost at the chair. You want your patient over the top of that chair, but leave a little bit of room between their legs and the chair. Then lock your brakes. Come around, ask your patient to stand. Take the swivel seats, get them out of the way, and then have your patient sit in the chair. Okay? Unlock your brakes. Ask your patient to lift their feet off the foot plate, and then you're good to go. Remember that you want to wipe this down. If it's an isolation patient, you're going to use bleach. If it's a normal patient, you're going to use Cavi wipes.